The hepatitis C virus is a silent enemy which is chronically damaging the livers of 3 to 5 million people in the United States and over 170 million people around the world. Each year, more than 15,000 Americans and about 350,000 people worldwide die from the complications of hepatitis C. Most people with hepatitis C do not have symptoms and may not be aware of their condition until they have advanced liver damage. While hepatitis C can have serious complications, it is now curable in most people, so it is important for people to get diagnosed and treated.
Hepatitis C is a condition of liver inflammation, really chronic liver inflammation, caused by infection with the hepatitis C virus.
When we talk about symptoms among this group with chronic hepatitis C, what's important to point out is most of them won't give you a symptom. In other words, this disease is progressing insidiously, and they could have it for decades, and often there won't be a complaint. If retrospectively, after they find out they have hepatitis C, they reassess, the most common symptom is fatigue.
Most commonly, people acquire HCV infection by contact with the blood of HCV-infected persons in ways that are sometimes obvious and sometimes not so obvious. People with any risk factors should be tested for hepatitis C. Common risk factors for HCV infection include blood transfusions prior to 1992, illicit injection drug use, exposure to contaminated needles, medical or tattoo instruments. Sexual transmission is rare but can occur. More information is available at the Centers for Disease Control and Prevention website.
They have a point of contact test. There's one out that's being looked at now. They can even take saliva or take a little blood and in 15 minutes say you have the antibody to C. If you have the antibody, that's a big step forward, but you then would have to send blood for the virus. That's what's important. The virus is HCV RNA, hepatitis C viral RNA.
Current therapy cures most patients with hepatitis C, though side effects can be difficult for some patients. While many patients will benefit from prompt therapy for their HCV infection, some patients with early stages of hepatitis C can defer treatment, preferring to wait for even better therapies that will soon be available. Until recently, antiviral treatment of hepatitis C involved a combination of interferon injections and daily oral medications.
We progressed to the point from having treatments that were quite limited and quite toxic. We're on the brink now of having treatments that will be quite simple, oral pills that will be easy to take. People will need to take them for only about 3 to 6 months, and their hepatitis C virus infection will be cured in probably 90% or more of cases. This is just a huge advance.
The Centers for Disease Control and Prevention is recommending that the baby boomer generation, people born between 1945 and 1965, be screened for the HCV infection.
I strongly endorse the CDC's recommendation, and that is to not only test, as they have been, people who give you a risk factor, and often they won't, but to really target that part of our population where most of the people have chronic C right now. The most important thing to realize is, one, that 75% of the people who have hepatitis C right now don't know it. That's why it's so important to get screened. The second most important thing is that we are entering an era where over 90% of the people who have hepatitis C will be cured with a treatment that's well tolerated, that is revolutionizing our management of C.
If you have any of the known risk factors for HCV infection, or you are a baby boomer born between 1945 and 1965, please visit your healthcare provider for hepatitis C evaluation. It's an appointment that could save your life. To learn more about hepatitis C, log on to the websites of the American Liver Foundation or the Centers for Disease Control and Prevention.